and welcome to podcast number 53 of NICU and Beyond with Tracy and Stacy. Our topic of the day is going to be HIE, which stands for Hypoxic, Ischemic, Encephalopathy. So what is HIE? This happens when a baby's brain is deprived of oxygen-rich blood. This typically occurs during labor and delivery, but it can occur before or soon after birth. There is a lack of blood flow to the brain, and it can lead to brain injury or even death if oxygen flow isn't reestablished. Brain injury occurs in 3 stages: immediate brain cell injury from a lack of oxygen and glucose, a latent period of about 6 hours where some brain cells recover, and a second injury phase over the next 24 to 48 hours as blood flow increases and toxic neurotransmitters spread. There are different treatments, and Stacy is certainly going to talk a little bit more about this. I'm going to talk about how common is HIE. HIE occurs in 1 to 5 births per 1,000 in developed countries, in as many as 20 per 1,000 births in low to middle income countries.
So what are the symptoms of HIE? The symptoms of HIE, a lot of times when babies born and come to the NICU, we say they look like saw a deer in the headlights. They have a stare, but there's also other symptoms. Decreased muscle tone or floppiness. Atypical eye movements or pupil reflexes. We might use a flashlight to check their pupil reflexes, and their pupils, they might not dilate. Usually in the first stages of HIE, we don't get to the point of poor or no ability to feed. They might have periods of apnea, is when they forget to breathe. They might have deeper than usual breaths, and HIE babies can show signs of seizures. Seizures is a very complicated thing in newborn babies and in preemies because seizures don't appear as what you normally see with adults. But the main thing is if we suspect that a baby has possibly HIE, the first thing that we do immediately is turn the heat off of the warmer. And this is what we call passive cooling, but I'll get into the cooling thing after we go through what causes the HIE.
For most cases, it occurs during difficult births. HIE can happen during labor, during the delivery itself, or afterwards. It can occur after birth if your baby needs resuscitation or experiences other complications. There's other potential causes of HIE. So some of the biggest ones are disrupted blood flow to the placenta abruption or early separation of the placenta from the uterus, high or low blood pressure in the pregnant person, low oxygen levels in the blood of the pregnant person, umbilical cord compression or prolapse, meconium aspiration. This is when your baby inhales a mix of amniotic fluid in their first bowel movement. Uterine rupture, severe infection, low blood count or blood pressure in the baby, lung or heart failure in the baby, or problems with heart or lung development. So what are the potential risk factors for HIE? I have a couple of them here, but I'm sure there's much more. The biggest one is low birth weight, amniotic fluid contamination, or a low 1 minute and 5 minute APGAR score, which I'm sure Stacy can tell us a little bit more about that.
Tracy was talking, she was saying about the low APGAR scores. Every baby when they're born is assigned an APGAR score. Usually a good APGAR score is of 8 and 9. The APGAR scores, when we have the baby, we have a timer on our warmer when we go to the deliveries and we push that. And the APGAR scores are done at 1 and 5 minutes. The points are for breathing, heart rate, muscle tone, skin color, and reflexes. There's a thing, we take off points for each one. If your baby has a low APGAR score, neonatal nurse practitioner that might be at the delivery, or the neonatologist, along with a NICU nurse and definitely a respiratory therapist. The neonatologist or the NP may suspect that your baby isn't getting adequate oxygen, especially if there were complications during the delivery. As Tracy said before about meconium aspiration, and yes, it sounds awful that your baby inhaled his or her poop into their lungs. So how do we diagnose HIE in a newborn infant? There is a step of protocol, and if the baby checks off all the boxes in the protocol, then we will cool the baby. Not every NICU is a cooling center. Usually you should look for a level 3 NICU. Level 3 NICUs mostly have the cooling blankets. We do a check off of their breathing rate and all that stuff that we discussed before. Then that we also do some lab work. We do a blood gas. We're not going to get into blood gases today because it's very complicated, but if we do a blood gas, and there's a thing in the blood gas called a base excess, and if it's minus a certain amount, we don't mind like -1, -2, but I've seen everything as a base excess of -15. That baby definitely would be cooled. The other thing is most of our cooling babies are greater than 36 weeks. Most of them are full-term babies, maybe post-date babies, usually big football bruisers that might have gotten stuck, had a hard delivery, was a shoulder dystocia, which means when their shoulder gets stuck. Could be that the baby was having decelerations, which means dropping their heart rate while they were in utero. They went in for the C-section. Also, we get babies from C-sections that need to be cooled also. If we have to go transport to go get a cooling baby, the first thing we tell the hospital that we're going to is to turn off the heat. That's called passive cooling, and we will turn off our heat in our transport isolate. Although if we fly, for our transport, we now have a thing called a Ticotherm, and we can actually start cooling as soon as we get to the baby at the referral center. Now we treat HIE. If the baby meets all the protocols, then we will do hypothermia, which is also called cooling therapy, and there is strong evidence that it can minimize brain damage. The cooling can be done with the cooling blanket or a cap. And basically what this is that we lay the baby on a blanket that has 2 tubes coming out of it. And then we circulate cold water through this. We always warn the parents that when you touch your baby is going to be very cold. Drop the baby's temperature down to about 33 degrees Celsius. Normal baby's temperature is 36.5 degrees Celsius to 37.2 degrees Celsius. The sooner that we can get the baby to start cooling, the better outcome that there is. This is a process, and it takes about 72 hours to complete. There will be lab work. Your baby might be intubated. Your baby might have lines in their umbilical stump that we can use to draw blood, because we do draw a lot of blood during this cooling process. Even though the cooling process, your baby's going to be on EEG or something to watch their brain waves, that we can see if the baby's having a seizure during the cooling. But most of our problems, you'll see that your baby will have 2 nurses to 1 is during the rewarming process. And this is when we can see more problems.
There could be a number of different types of things that can happen, and it depends on what part of the brains are damaged and the severity of that damage. Some of the ones that they list here are cerebral palsy, epilepsy, intellectual disability, speech or language problems, learning disability, developmental delays, visual or hearing impairment. We got to remember, though, there's something that the babies have called neuroplasticity. It's the ability of the cells in the baby's brain to create new pathways to adapt to damaged areas. So having this elasticity really plays an important role in the recovery from brain injury. Researchers are still investigating this role in neuroplasticity, but when I worked in early intervention, the sooner we got to these babies, the better the outcomes. What are the long-term outcomes? About 25 to 60% of surviving infants have long-term complications. More severe HIE is associated with a higher chance of complications or death. Again, I usually saw the babies in the NICU after they were rewarmed so we could start teaching the parents what we needed to do developmental wise, while the nurses continued on and worked on all the medical things with them and teaching. This was a baby that really needed all hands on deck as far as all the disciplines in the NICU. So I hope this podcast was informative. I am so happy to have my friend back to talk about HIE today. If you like this, please like us. Better yet, you can follow us, or you can find us on our websites at www.parentnicuconnection.com, or my newest website, which is https://peds.thinkific.com. We will be on in a couple weeks with a new topic. You all have a wonderful day. Bye-bye.
Bye-bye.